Hello friends, welcome to the healthcare today. Today we are going to talk about viral infections. These days when there is especially seasonal change, especially winter to summer and summer to winter, you see viral infections happening around you. So especially these days one of the family member is falling sick and he is transmitting the viral infection to everyone who is close to him. So when we speak about viral infections, we have to speak about influenza virus and other common viruses like COVID, coronavirus as well as adenovirus. So influenza virus are usually two types, influenza A, influenza B. There are some para-influenza viruses as well, but most common viruses which lead to common cold is influenza A and influenza B. One such variety of influenza A virus is called H1N1, which is also called swine flu virus. So we are seeing increasing cases of swine flu these days, which is leading to significant mortality. So to speak about swine flu, what is swine flu? So before COVID happened in 2005, there is something called swine flu pandemic which happened, where there are a lot of destruction of lives which happened because of the flu. So as like COVID, we also know that H1N1 is also a virus, so the treatment is largely supportive. For example, if the patient is requiring oxygen, you give oxygen. For example, if the patient is requiring kidney issues because of the hypoxia, if the kidneys have shut down, you will give dialysis. So what exactly happens in this disease is, lungs are breathing organs, they are completely elastic. Once you take the breath in, the lung expands. Once you leave the breath out, the lung collapses. So due to the viral infection, there will be significant exudates which will be coming inside the lung, which leads to stiffening of lung. So the expansion capacity of the lung decreases. So that is the reason why even if you give oxygen, the patient's lung is unable to utilize it. So when initial part of the disease, when the patient is breathless, we give oxygen therapy. In spite of giving oxygen, if the patient is not maintaining saturation, we shift him to non-invasive therapy. In spite of non-invasive therapy, if the patient is not improving, we intubate him and put him on ventilator. Many times, in spite of intubating the patient and giving 100% oxygen, the patient doesn't maintain saturation. So that time what we do is prone ventilation. We ask the patient, we turn the patient upside down, give prone ventilation for 18 to 20 hours and see whether the patient is improving or not. With prone ventilation, what happens is the dependent areas which are not well aerated, they come up and they increase the oxygen levels. So few patients respond with oxygen, few patients respond with non-invasive ventilation, few patients respond with intubation, few patients respond with prone ventilation. But what happens when the patient doesn't respond to anything? Then we have an option called ECMO, which is called extracorporeal membrane oxygenation. Just like a dialysis machine, this machine brings the blood out from the body, gives oxygen to it and pushes blood back into the air. So this machine is given as a supportive therapy or a bridge therapy if the patient is requiring lung transplant due to excessive lung damage. But usually ECMO, we support the patient till the lung recovers on its own. So, and ECMO is very expensive. So before speaking about treatment, we should know what we should do once we experience these symptoms like common cold and all. The first and foremost thing which you need to do is, once you have fever, loose motions, generalized body pains, sore throat, these are the signs of viral infections. Then you need to isolate yourself from your near and dear ones. And once you are isolated, try to walk inside the room and see whether your saturation is dipping down. The earliest sign of worsening is saturation dipping down on walking, exertional breathlessness. So that is the time you need to consult your doctor. The earlier we start your therapy, the earlier we give you supportive therapy, the better is the chance of recovery. Now the second thing, once you know that you have symptoms, when should we go for treatment? We have only one antiviral available, which is called oseltamivir. So that research says that once it is given in the initial part of the disease, especially in the day 1 and day 2, it is more helpful. But once the patient presents after 48 hours, the research says that oseltamivir is not much helpful. But in spite of that, we do give to the patients to decrease the viral load as well. So what is there any other option to completely prevent this disease? Yes, there is vaccine available for flu, which is the flu vaccine. Every year around Diwali, we vaccinate our patients because the new strain comes at that point of time. Patients who have chronic lung diseases like asthma, COPD, bronchiectasis, chronic kidney diseases, chronic liver diseases, patients who are hypertensive, who had pacemaker, all these chronic patients, especially diabetic patients or chemotherapy patients, all these patients, we ask them to get them vaccinated with a flu shot. So the flu shot contains influenza A, influenza B and H1N1 as well. So the antigen response takes around 4 to 6 weeks to develop. So the flu shot prevents you from having severe H1N1, but it doesn't prevent you from having mild and moderate H1N1 or mild and moderate flu. So taking influenza vaccine is very helpful. It prevents severe flu infections. And every year around Diwali, especially if you are immune compromised, please do take it. And we care about you.